Leo, if I don't go home this winter, can I go back where I was before? In Hamilton, that is. Because I will not get used to this, the way they treat us here. It's like just if somebody died every day and we practically starve. I believe that the nurses could do away with us Inuit if they were not making money. We are the only reason they make a living.
Here is what we are always looking for, the 1 in 1,000 chance that somebody with a positive tuberculin test actually has tuberculosis. Sanatorium board records are constantly accumulating, and they indicate up to the present that 999 out of 1,000 people with positive tuberculin tests have chest x-rays like this, free of tuberculosis. It is our hope and determination that our records will continue to show steady improvement year after year.
But in the 1950s, it's estimated that 1/3 of the Inuit population tested positive for the disease. And letters from more than 800 Inuit patients have been sitting here at the Library and Archives of Canada, untouched for years. And for the first time, their families are reading their harrowing accounts of what happened. Families like Sarah Aragutanak's.
They didn't have jobs back then, so the only way they made money was to carve.
At the height of the tuberculosis epidemic of the 1950s and 1960s, her family was forced to travel south for treatment. Thousands of kilometers from their home in Belcher Islands, now called Sanatilwak, Nunavut. She doesn't know much about what happened there.
My mom did, but not a lot, but she told me that they had to wait for a really long time to get home. I know that they were in moose factory for medical treatments, and it was really hard for them, especially not going home for a really long time, because today we go here to Winnipeg and we stay for like 2 days or a week. Worst part, they were not allowed to get out of their hospital bed. They didn't go home for a really long time. They were lied to. It's maddening.
According to these patient letters obtained by APTN Investigates, both of Sarah's grandfathers, Joe and Noah, and her uncle Joe, carved sculptures while they were being treated. But in this letter, her granddad Noah complains of being ripped off. I was also expecting $37 for a piece of art in Hamilton, but I only got half the amount. Out of the 800 patients we identified in the letters, half of them were known artists. We found out Sarah's family created a small collection of carvings, now on loan to the Winnipeg Art Gallery.
My mom is Annie, and my late dad, is Johnny Arodeno. My mom used to make owls and other animals, but I mostly remember about owls, but I don't remember much about my dad.
You never saw him carving?
I never saw him carving, but only my mom.
And where do you think your mom learned how to carve?
She learned it from her dad. She used to help him polish the carving, and that's how she knew how to carve.
We brought Sarah for a visit in February 2020. what kind of stone this is?
I'm not sure,
You don't know.
but I like the ice.
I know, right?
Oh, that's so really cool.
Curator of Inuit art, Darlene Coward-White brought her into the vault.
Wait. Oh my God. Jonesy, my dad. Annie, my mom. George, my uncle. From my mother's side, my grandpa Joe. Remember, my grandpa Joe used to have so much love towards everyone around him. My grandpa Joe, my grandpa Noah, my mom Annie, my grandpa Joe. I think this is my cousin George. They carved for a living to provide for the family. That was the only way they provided for the family because there weren't a lot of jobs.
But Sarah's is just one family, and many other patients are in the collection of letters. Patient Tommy O'Nalick left a legacy of carving behind. His daughter Annie Andruyak explains.
He made little miniatures. He was even featured in a Toronto exhibit about his miniature carvings and the packing boxes he made for them. He made individual packing boxes knowing that they're going to be sent away. So he would convert a cereal box to accommodate that little man on a kayak, full with everything, the soapstone kayak, the ivory man, the ivory tools, little ones. I remember him making those.
In this letter, he complains to a program officer. It seems to me I came down here just to do some carving, and they make us carve things I don't like carving. They also don't pay much. Others offer first-hand accounts of what hospital life was like for them. The staff here do not bother with us. There is a blind person who has been here a week and has not even been washed. I want to go home where I don't have to pay for my meals. Many others were carvers as well. Made 2 carvings and wonders why he hasn't been paid. The white people are trying to put one over on us Eskimos with our carvings. The teacher and sellers on carvings are being that way about the pay. Half of the writers in the collected letters were also carvers. Galleries across Canada exhibit carvings by Inuit TB patients. Stephen Boris is the director and CEO of the Winnipeg Art Gallery. The largest Inuit art center in the world is set to open soon. We asked him about the artwork produced by patients at the hospital in February 2020.
I mean, we're completely transparent here, but the challenge is to actually identify that work was produced in the hospital. When you have a collection of 30,000 objects, it could take years and decades to research every single object. But we are committed because that's part of what we do as a museum, researching the history of each object.
We did some of that research for the art gallery and found artists whose work correspond to their time in hospital. We'll have that story coming up. So I'm going to give you this letter that we found.
Okay. Dear Leo, I'm writing to you to let you know that I have received your letter. I just returned to Moose Factory from Hamilton. It is very sickening. Leo, if I'm not going home this summer, would you ask the doctor if I can at least go outdoors? Oh my God.
Sarah Aragutanak's family wrote about their artwork while living in the sanatorium. Carvings like her family's are widely recognized around the world, but the history of how they became iconic is less known. Darlene Coward-White is the curator of Inuit art at the Winnipeg Art Gallery.
Well, Inuit have always carved because they had to make everything. Like, they made all their tools and their weapons and their utensils. Everything was carved out of ivory, antler, often sometimes stone. They would make their pots out of stone. It was really like about 1949 is the date that we see it as beginning, because that's when a young artist, James Houston, went up to Inuit. He saw people making little carvings, and sometimes they would use them as toys for their children. And people at that time were used to making ivory carvings for trade. But he was really quite excited about the idea of people making stone carvings, and that they could actually sell them at the Hudson's Bay Company Post. And so in 1950 he went up, he did a test purchase. They were all sent down to the Guild of Crafts in Montreal, and there was a sale.
James Houston worked for the Hudson's Bay Company back then, and the Department of Mines and Resources hired him to buy art in the north. He produced this pamphlet instructing Inuit on what would sell down south.
And so that's when things really changed. It really became a very important way for people to make money.
In 1952, the government held a conference to discuss what they called the Inuit problem, defined as economic instability, government dependence, and poor health. That led to horrific policies like the high Arctic relocation. Inuit families were moved to desolate northern areas under the guise of protecting their way of life. In this 1994 National Film Board documentary, Broken Promises, survivors described what it was like.
And when the police found out that we were scavenging for food in the garbage dump, he would search our whole house to find what we took from the dump.
When the City Hall came again in August in 1954, we got our X-ray. That's when I was told that I had advanced TB. So I really had no choice. So I went down to Manitoba. When I had to leave for the hospital, I was scared. I didn't want to leave my family, but I wanted to get well. Many of our families had to spend a great deal of time in the hospital. So a lot of us grew up without the care of our mothers.
Guy Darjancourt's mother, Leah Idluout, translated the majority of the letters in the collection.
This is historical evidence of what had happened based on government policy to families, not just the individuals who are affected by the policies, but their family members, an entire culture.
She was also treated for tuberculosis at the age of 12 down south. Idluout was a trailblazer, a teacher, journalist, and editor. For Darjancourt, the letters reveal the reach of his mother's work.
It adds another piece to the puzzle. We knew her as a person. We didn't know as an employee or her work or how much of an effect on a lot of people she must have had. I mean, I'll always be proud of her before knowing about this, but this is like, wow.
According to Inuit's boss at the time, Walter Rudnicki, a longtime director of the Arctic Division, putting Inuit on welfare was the last thing the government wanted.
Inuit would get gravitating into towns, into hamlets for work, or because services were available there. And they were becoming dependent, and there was no more serious issue for the heads of Arctic Division and Northern Administration branch than anybody going on welfare.
Coward White echoed that.
They'd always done sold furs at the Hudson's Bay Company, but the foxes were declining. So really from that time on, the government was very much involved in trying to encourage this as a way for people to make money.
Tuberculosis patients were top of mind for Rudnicki. He testified at the Kikatani Truth Commission in 2005. Carving was built right into recreational programming at tuberculosis hospitals and yielded thousands of dollars. But conditions were less than ideal. This patient letter explains. No wonder the Eskimos don't get better quickly. They carve in the room and the soapstone makes a lot of dust. I am carving for the Hudson's Bay people, the police, and the school teacher. And many patients complained of not being paid. Nurses, doctors, and even RCMP officers could buy from patients directly. But according to Rudnicki, that's not the only thing some of them took home.
And I found quite a few of these so-called vanished kids. I took their disc numbers. Everybody, of course, had disc numbers then, which was a way of identifying people for sure. There were just too many Joannesses in the world there. And I frequently discovered that a kid hadn't died, that some well-meaning physiotherapist, nurse, or even doctor took a liking to a child and took him home like a pet.
Carving was touted as a way for Inuit to express their world. Here, at the Winnipeg Art Gallery, a new Inuit art center is set to open. We found 7 patients who have art in the WAG collection that corresponded to their hospital confinement, and more than 140 artists overall. We shared our findings with director and CEO Stephen Boris in May 2020. He committed to ensuring these patient letters will be part of the story.
And this story about those Inuit who were in TB hospitals in the South is part of the history of Inuit art. And it's a story that is being told, but could even be told with greater depth and exposure to the Inuit Art Center.
And the Winnipeg Art Gallery has researched the artists even further. They are collaborating with us to bring recognition to the painful history.
And I think those letters would play a critical role in an exhibition, in a program, any initiative we do here that focuses on those decades in those hospitals in the South.
But the dark history of Inuit carving is often not a part of the conversation among institutions. According to Brock University professor Maureen Lux, that is an important history, and it is still relevant today.
Understanding the history of healthcare and Indigenous people in Canada enlightens us as to, the concerns about healthcare in the present. That it was not very long ago that there was systemic racism in the hospital system, and many would say it exists to this day.
We asked Sarah if she thinks institutions should mention the painful history of Inuit carving.
They should display the carvings along with the letters because they were in the TB hospital and they were told to carve, and they were told that they would get paid this much, but then they were only given half of the pay.
As Lux points out, including the patient history is essential.
Unless we get patient perspectives that we understand how that worked and what it was like for patients, being told what to carve, being told that, you know, their work wasn't good enough, or, you know, we want more of this and not enough of that. These kinds of things make it sound more like a, you know, burgeoning business.
For Sarah, that history is still sinking in.
I can't imagine what they went through. Not just them, every person who was down in Moose Factory.
She doesn't want the sculptures back. She's proud of the work where it is.
Other people will know what Inuit used to do or still do to provide for the family or for themselves. So I'm proud about that. So that people will know and see how hard Inuit work to provide for the families. And it's a piece of art that should be remembered.
The coronavirus pandemic.
Head directly home. Do not stop for groceries or other essential supplies. Do not go out into public spaces. Once home, you're required to remain there and quarantine yourself for 14 days.
This wasn't the documentary that I had planned. I had a chance to work with APTN Investigates, and I pitched a story about youth gang prevention. And then, the novel coronavirus swept across the globe.
To leave my family here, I can't see them, I can't hug them, I can't socialize with them.
First Nations declared states of emergencies as fears about the virus ramped up.
So we're planning for the worst and hoping for the best.
You know, we have come through a lot of traumas.
So like any good journalist, I adjusted. Asked the question, how is this impacting Indigenous people?